Today's show comes to you courtesy of the sacred vows of survey ethics. Every interaction, every question asked, every answer received is governed by an unseen, ancient code of honor. We are the solemn custodians of digital trust, meticulously weaving cloaks of invisibility around personal identities and erecting shimmering barriers of confidentiality. It's a profound commitment to protecting the very souls of our participants' truths, ensuring that their voices contribute to knowledge without ever surrendering their sacred right to privacy.
Welcome back to The Deep Dive, our series on survey research for the medical laboratory scientist. In our previous episodes, we laid all the groundwork. We talked about the foundations of survey research, we meticulously designed our questionnaire, and we strategized how to sample our population and collect the data.
That's right. And if we use a lab analogy, we've essentially completed the entire pre-analytical and analytical phase of our project. We've identified our patient, our target population. We've chosen the right collection tube, our survey instrument, and we've collected the sample. We have a pile of responses, whether they're on paper, in a spreadsheet from an online tool, or in a folder on our computer.
Exactly. But now comes the critical post-analytical phase. This is where we take that raw data, which is often messy and full of potential errors, and turn it into something clean, reliable, and ready for analysis. It's the equivalent of taking the raw signal from our chemistry analyzer, putting it through QC checks, applying validation rules in the LIS, and preparing a final verified report.
It's a phase that I think is vastly underestimated. People get so excited about asking the questions and getting responses that they forget about the immense amount of work required to ensure the quality and integrity of that data. And this is where our MLS skill set really shines, our inherent focus on quality control, standardization, and documentation.
Absolutely. So today's deep dive is all about that post-analytical process. Our roadmap has 4 key stops. First, we'll tackle data entry and coding, how we get the raw answers into a structured format.
Second, we'll move into the crucial step of data cleaning and validation, where we hunt for errors and inconsistencies.
Then, a really important theoretical stop, we'll discuss the different types of survey error and bias. Understanding what can go wrong helps us interpret our results with the appropriate level of caution.
Finally, we will wrap up with the absolute bedrock of all of this, the ethical considerations that must guide every single step of the process. It's a journey from a chaotic pile of responses to a pristine, ethically sound dataset. So let's get started with that first step, data entry and coding.
Okay, so the survey is closed and you have your responses. If you used a good online platform like RedCap, SurveyMonkey, or Qualtrics, a lot of the initial data entry is done for you. The answers are already in a neat digital spreadsheet. This has been a game changer for reducing simple transcription errors.
A huge game changer. It's the difference between having a modern analyzer that interfaces directly with the LIS versus having to manually type in every single result. The potential for error in manual entry is massive. But let's be realistic, sometimes we do have to use paper surveys, especially for certain populations or in specific settings. So what are the best practices when we're faced with that stack of paper?
This is where we put on our specimen accessioning hat. The principles are identical. The first non-negotiable rule is to assign a unique identifier. Every single physical paper survey gets a unique ID number written on it, and that ID number becomes the very first variable, the first column in your dataset.
That sounds exactly like assigning a specimen an accession number the second it enters the lab. You have to be able to trace that digital data point all the way back to its physical source. If you see a bizarre entry in your spreadsheet, say someone answered a 7 on a 1 to 5 scale, you need to be able to pull that exact piece of paper and see if it was a data entry error or if the respondent really did write something strange. Without that unique ID, you're lost.
You are completely lost. Now, for the gold standard of manual entry, something that we in the lab can really appreciate is double entry verification. This is where 2 different people independently type the data from the same batch of surveys into 2 separate files. You then use software to compare the files.
The software will flag every single cell where the two files don't match.
It's a bit like having two laboratory scientists read a complex manual differential or a bone marrow spide. You're looking for inter-observer agreement. It's incredibly resource intensive, which is why it's the gold standard and not always practical, but it is by far the most effective way to catch keystroke errors and transcription mistakes.
A more practical and very clever method you can use in programs like Excel or SPSS is setting data validation rules. Before you even start data entry, you can program the cells. You can tell the program the only valid entries for this column, Q5, are the numbers 1, 2, 3, 4, or 5. If the data entry person tries to type a 6 or a T, the program will immediately reject it with an error message.
That's fantastic. It's a real-time QC check. It's the LIS flagging a result because it's outside the reportable range or fails a delta check. It stops the error from ever getting into the system in the first place.
Once the data is in the spreadsheet, we have to move on to coding. Coding is the process of turning the answers into numbers because our statistical software needs numbers to work with. For closed-ended questions, this is easy. Yes becomes 1, no becomes 2. Chemistry becomes 1, hematology becomes 2, microbiology becomes 3, and so on. This is usually planned in advance, a process called pre-coding.
The real monster is coding the open-ended questions, the please explain your answer or what is the biggest challenge facing your lab type questions. You might get hundreds of different free text answers. This is where you have to do something called post-coding. You, the researcher, have to read through a sample of the responses and create categories, what's formally called a coding frame.
And a good coding frame has to be two things: exhaustive and mutually exclusive. Exhaustive means every response you receive can fit into one of your categories. You usually need an other or miscellaneous bucket for this. Mutually exclusive means each response fits into only one category. You can't have staffing shortages and recruitment issues as two separate codes if they overlap too much. You have to create really clear definitions.
If you have multiple people doing this coding, you absolutely have to do intercoder reliability checks. You have them all code the same 50 responses, and you measure how often they agree. It's another form of QC to ensure that the code morale issues means the same thing to coder A as it does to coder B.
One final and absolutely crucial part of coding is how you handle missing data. You can't just leave a cell blank. A blank cell is ambiguous. Did the respondent skip it by accident? Did they refuse to answer? Or was the question not applicable to them because of a skip pattern?
That's such an important distinction, and it has a direct parallel in the lab. When a result is missing in the LIS, we need to know why. Was the sample quantity not sufficient? QNS? Was the test canceled? Was there an instrument error? Each one means something different. Leaving it blank is just uninformative.
Exactly. So in survey research, we use specific numeric codes. For example, a don't know response might be coded as 88. A refuse to answer might be 99. A not applicable might be left as a system missing value. By using distinct codes, we can later decide if we want to analyze the people who refused or exclude them without accidentally averaging a 99 into our calculation for satisfaction on a 1 to 5 scale.
So at the end of all this, you should have two things. First, your clean coded data file, and second, and just as important, your codebook. The codebook is the master document, the SOP for your dataset. It lists every variable name, what the variable means, what the numeric codes stand for, like 1 equals female, 2 equals male, and how you handled missing data. Without a codebook, a dataset is practically useless to anyone else, or even to yourself a year later.
Okay, so we have our coded dataset and our codebook. We're ready for analysis, right?
Not even close. What we have now is still the raw data, just organized. It's like having all your QC data entered, but you haven't actually reviewed the Levy-Jennings charts yet. Now we have to actively hunt for errors, outliers, and inconsistencies in a process called data cleaning and validation. The goal here is not to manipulate the data, but to make sure it's an accurate reflection of the responses we received.
First on the list is to take a deeper look at that missing data we just coded. We need to understand why it might be missing. Broadly, there are 3 types. The best case scenario is missing completely at random, or MCAR. This means the reason a value is missing has nothing to do with any other data. A random server glitch deleted a few answers, for instance. It's just bad luck.
The next level is missing at random, or MAR. This is more complex. It means the probability of a value being missing is related to another variable we've measured, but not the value of the missing data itself. For example, let's say we ask a question about comfort level with new automation. We might find that laboratory scientists with 20+ years of experience are less likely to answer that question than laboratory scientists with less than 5 years. The missingness is related to years of experience, which we measured, but not their actual comfort level, which is missing.
And the most problematic type is missing not at random, or MNAR. This is when the reason for the missingness is related to the value of the missing data itself. A classic example, asking about annual salary. People with very high or very low incomes are often less likely to answer. Or in a lab context, a survey on burnout. The most severely burned out employees might be the least likely to have the energy or motivation to respond. The fact that their data is missing is directly related to their high level of burnout.
And this is a huge problem because it introduces a serious bias. If we just ignore that missing data, our results will look much more positive than reality. So how do we handle it? The simplest way is list-wise deletion, just deleting any respondent who missed even one question from your analysis. It's easy, but it's dangerous. You can lose a huge chunk of your sample size. And if the data is an MCCAR, you are definitely introducing bias.
It's like throwing out every single patient sample of had even one test canceled. You'd end up with a very small and likely skewed population. A better, more advanced approach is imputation, where you replace the missing values with plausible estimates. Simple imputation, like replacing a missing value with the average of all other responses, is pretty flawed also because it squashes the natural variation in the data.
Right. That's why researchers now prefer more sophisticated methods like multiple imputation. This is a statistical process that creates several complete data sets, each with slightly different plausible values for the missing data. You run your analysis on all of them and then pool the results. It's complex, but it does a much better job of preserving the underlying truth of the data while accounting for the uncertainty of the missing values. It's not something to be done lightly, but it's important to know it exists.
Okay, so we've thought about missing data. The next thing to hunt for is outliers. These are data points that are way off from everything else. And just like in the clinical lab, an outlier could be a true extreme value, or it could just be an error.
That is the perfect analogy. You get a potassium result of 9.0. Is the patient in critical danger, or is the sample hemolyzed? You have to investigate before you act. In a survey, an outlier might be someone who says they work 120 hours a week. Is that an error? And they meant to type 20? Or are they a resident who is actually working that much?
You have to check the source document if you can. If it's a clear error, you correct it. If you can't determine it's an error, you have a tough choice. Deleting a legitimate outlier is bad practice because you're misrepresenting the true range of your sample. Sometimes you can use statistical techniques like transformation, using a logarithm to pull in extreme values, or Winsorizing, which is basically capping the value at, say, the 99th percentile.
The final piece of cleaning is checking for inconsistencies, which are logical contradictions in a single person's responses. This is where you run logic checks. For instance, a respondent indicates their primary department is blood bank, but then answers a series of detailed questions about esoteric microbiology testing. Or a person who is 25 years old and says they have 30 years of lab experience.
These are your LIS flags for impossible combinations. The system won't let you result a positive pregnancy test on a patient registered as male. In survey data, when you find these, you first check for a data entry error. If there is no error, you have to use your judgment. Sometimes you can infer the correct answer. More often, the safest route is to change the contradictory values to a missing data code, acknowledging that those specific answers are unreliable.
So this entire process of cleaning and validation is designed to minimize error, which brings us to a bigger topic, the concept of total survey error. The idea is that there's a difference between our final survey estimate and the true value in the population, and that difference comes from multiple sources of error.
This fits so well with the lab's total testing process. We know error can be introduced at any stage. Pre-analytical, wrong patient ID, wrong tube. Analytical, instrument malfunction, QC failure, or post-analytical, LIS error, results reported to the wrong chart. A good lab professional understands all these potential pitfalls, and a good researcher needs to understand the sources of survey error.
The one everyone knows about is sampling error. This is the error that exists simply because you're studying a sample instead of the whole population. By chance, your sample might be slightly different. It's the only error we can actually calculate, and it's represented by the margin of error. The main way to reduce it is by increasing your sample size.
That there are other, more sinister errors, like coverage error. This happens when your sampling frame, the list you draw your sample from, doesn't match your target population. For instance, you want to survey all MLS in your state, but you only use a membership list from one professional organization. You are completely missing everyone who isn't a member of that organization, and they might be systematically different.
That's a huge problem. It's like trying to assess the health of a whole community by only drawing blood from patients who visit a specific clinic. You have a massive gap in your coverage. A related and even bigger problem is non-response bias. This occurs when the people who choose not to do your survey are different from the people who do. We touched on this with the burnout example. If the most unhappy employees don't respond to your workplace satisfaction survey, your results are going to be artificially inflated. Your data will show that satisfaction is higher than it really is. This is one of the biggest threats to the validity of survey research. You have to be aggressive with reminders and follow-ups to try and get responses from those initial non-responders.
And then there's measurement error. This is when the answer you record is not the person's true answer. This isn't about who you sampled, it's about the accuracy of the data collection itself. A major source is just poorly worded questions, ambiguous, leading, or double-barreled questions that confuse people.
Other sources are respondent factors. People have poor recall, or they might give socially desirable answers. You ask, how often do you follow proper hand hygiene protocols? Everyone is going to say always, even if it's not strictly true. They want to present themselves in a good light.
Absolutely. And finally, the method of the survey, or the mode, can introduce error. People might be more honest about sensitive topics like mental health or workplace conflicts in a completely anonymous online survey than they would be in a face-to-face or even phone interview with a person. Understanding all these potential errors doesn't mean your research is worthless. It means you have to design your study to minimize them and then be humble and transparent about the remaining limitations when you report your findings.
And that brings us to our final and most important topic today, ethics. Everything we've discussed, from designing the questions to cleaning the data, has to be built on a foundation of ethical conduct. In the clinical world, this is our prime directive. Patient safety, patient rights. HIPAA. In research, it's about protecting the rights and welfare of our participants.
It's the absolute bedrock. If we lose the public's trust, people will stop participating in research and we can't advance our knowledge. The cornerstone of ethical research is informed consent. This isn't just getting a signature on a form, it's an active process of ensuring someone understands what they're getting into before they agree to participate.
The essential elements must be clearly explained, that it's for research, what the purpose is, how long it will take, what they'll be asked to do, any potential risks, like feeling stressed by sensitive questions, and any benefits. And most importantly, that participation is 100% voluntary, and they can quit at any time or skip any question for any reason without penalty.
The without penalty part is critical. You can't have a manager tell their staff, I expect everyone to complete this survey. That's coercion, not voluntary participation. A key part of consent is explaining how you will protect their privacy. This brings up two related but distinct concepts, anonymity and confidentiality. They are not the same thing.
An important distinction. Anonymity is the highest level of privacy. It means that literally no one, not even you, the researcher, can link a participant's identity to their responses. A truly anonymous survey collects zero personally identifiable information. No name, no email, no IP address. What's far more common in research is confidentiality. This means the researcher can identify a participant's responses, maybe you need to for a follow-up survey, but you promise not to share their identity with anyone. You, the researcher, hold their identity in confidence.
And the way we uphold confidentiality is through good data security. This is the practical side of the promise. It means storing signed consent forms in a locked cabinet. It means storing digital data files on encrypted, password-protected servers with firewalls. It means creating a data management plan that says who has access to the identifiable data and when that identifying information will be destroyed. It's the research equivalent of our HIPAA security rules.
Finally, in any formal institutional setting, like a hospital, a university, or a research organization, we are not left to make these ethical judgments on our own. We have the Institutional Review Board, or IRB.
The IRB is an independent committee of scientists and non-scientists whose only job is to review research proposals to ensure they meet ethical standards and protect human participants. Before you can even send out your first survey invitation, you have to submit your entire plan, your survey, your consent form, your data security plan, to the IRB for approval.
They are our external ethics check. They're like the CAP or the Joint Commission for Research. They hold us accountable and ensure that our desire to get answers never comes at the expense of our participants' rights and welfare.
So, we've covered a lot of ground today, from the nitty-gritty of coding missing data to the high-level principles of total survey error and ethics. It's clear that the work that happens after the data is collected is just as, if not more, intensive and important than the work that comes before.
It truly is. We've taken a raw, messy, and potentially error-filled collection of responses, and by applying the same principles we use every day in the lab, standardization, quality control, diligent documentation, and a deep-seated ethical commitment, we've transformed it into a clean, validated, and trustworthy dataset.
And what's so powerful is realizing how much our MLS training prepares us for this. The obsessive attention to detail, the need for traceability, the understanding of QC and validation, the non-negotiable commitment to patient or participant welfare, it's all in our professional DNA. Applying that mindset to survey research is a natural extension of who we are as scientists.
Beautifully put. We now have this pristine dataset ready for the final step. Now we get to ask, what did we find?
I think that's the perfect setup for our next and final episode in this series. Now that we have the data, how do we analyze it? And just as importantly, how do we report and visualize our findings in a way that is clear, honest, and impactful?
I look forward to it. Join us next time on The Deep Dive as we tackle the basics of data analysis and reporting.